In a world where healthcare research is the beacon of hope for better patient outcomes, one of the leading research institutions in the Middle East found itself in a complex conundrum. The institution wanted to unearth subjective data that would link the amount of blood loss, represented by delta hemoglobin, to the readmission rates. The goal was also to identify potential predictors for increased delta hemoglobin and blood transfusion. However, the electronic health records and patient treatment data at their disposal were complicated and unstructured. It was like trying to find a needle in a haystack, and the challenge was to transform this vast, unstructured data into actionable insights. Blackcoffer's solution to this problem was no less than a journey of discovery, beginning with the deployment of statistical modeling using R, a statistical programming language. Blackcoffer's first step was an exploratory statistical analysis to measure descriptive statistics of the dataset. This involved calculating standard deviation, mean, trimmed mean, mean absolute deviation, skewness, kurtosis, and standard error for continuous data. Contingency tables reported for factor variable types such as gender and fusion level. Output. Blackcoffer's journey then moved into the realm of multivariate analyses, where statistical models were built and tested. These analyses were performed to calculate model estimates, standard errors, z-value, PR, yz, p-value, and odds ratio using logistic regression techniques. The aim was to hypothesize that a given outcome of interest, in this case, increased delta hemoglobin and blood transfusion rate, is affected or influenced by more than one variable. The risk factor for the response variable, which was transfusion, was calculated by performing a chi-square test on the multivariate logistic regression model. The final destination of this journey was prediction. Logistic regression was used to predict the cause for increased delta hemoglobin and blood transfusion rate, with a p-value of less than 0.05 denoting statistical significance. Further data modeling techniques were performed to visualize data and results. The impact of this journey was transformative. The institution designed and implemented multivariate models with a staggering 95% accuracy. Risk factor models were designed and implemented with 95% certainty, and predictive models boasted a 99% confidence level. The study of demographic and clinical data, such as age, sex, BMI, and ASA, was made possible. Risk factors for transfusion, such as age, BMI, operative time, estimated blood loss, pre-op hemoglobin, delta hemoglobin, and fusion level were reported. The institution was also able to use multivariate logistic regression to discover drivers for the association of transfusion with adverse outcomes, such as readmission and long hospital stay. Finally, a visual representation of estimated blood loss versus delta hemoglobin was achieved, providing a clear, succinct view of the data. In conclusion, the challenges faced by the institution were not only met, but conquered. Through the strategic use of statistical modeling and analysis, a complex and unstructured dataset was transformed into actionable insights, predictive models, and visual representations. Blackcoffer's journey of discovery not only provided solutions to the institution's challenges, but also opened up new possibilities for improving patient outcomes through healthcare research.